Coming to the highlights for renal cell carcinoma at ASCO 2024, I think the most important abstract of the whole Congress was presented on Saturday, and it reported on the overall survival for the use of adjuvant pembrolizumab in patients who underwent a nephrectomy for RCC. This study called Keynote 564, all patients had clear cell carcinoma and they had to have at least a stage PT2 grade 4 or PT3 any grade or higher. And the disease-free survival, which was the primary endpoint, has been reported several times before, the first time in 2021, and based on that, this treatment has been reintroduced in the clinic. However, so far there was always the question whether overall survival benefit is also achieved with this adjuvant treatment. And there was a lot of discussion about the fact that 3 other studies have not shown any disease-free survival nor overall survival benefit in the very same setting with fairly similar immunotherapy approaches. So the overall survival results have been really interesting, and there was a significant OS benefit proven for the use of 1 year of pembrolizumab compared to placebo. And so this certainly reinforces that this treatment is an option for patients with RCC after nephrectomy that fulfill the inclusion criteria. Still, we need to keep in mind that 3 studies have been negative. One part of one of these studies was shown at the same ASCO GU Congress a few days ago. This is the part B of a Checkmate 914 trial. In this study, the patients received immunotherapy with nivolumab for 6 months, or the combination with nivolumab and ipilimumab for 6 months as compared to placebo. And part A with nivo-ipi reported already over a year ago and was negative for the disease-free survival outcome, and the same was now seen with nivolumab. So 6 months of nivolumab have no significant impact on the disease-free survival. So in fact, we now have essentially 5 trials investigating immunotherapy in the adjuvant space for RCC, with the Checkmate containing essentially 2 studies. And 4 out of these 5 trials have been negative for the primary endpoint, and only the Keynote study has been positive. So I think we should discuss the possibility of adjuvant immunotherapy with our patients when they are fulfilling the inclusion criteria, but also discuss with them that other studies have not shown a similar benefit. And then a decision needs to be taken on an informed basis together with the patient.